Well, whole class. I only needed like 2 minutes, but I figure I can't make these, tremendously long. I know you can pause it, but I'm going to make a part two. This will be part two of the muscles, skeletal muscles of your body. So we're going to move on. We're going to do the abs, and then we'll move on to the lower limbs. And this is the shorter of the two lectures for sure. All right, so as we talked about in the early in this class, we talked about how your chest is well protected with your ribs, obviously your cranial cavity, your pelvic bones protect things lower in your pelvis, but your abs are just muscular. When you look at front, anything below your chest here is these muscles, and it's quite strong. You can tense them, and there's going to be 3 layers. And just like in plywood and such, you get more strength with layers, with fibers going in different directions. So the strength of the walls is not accidental. Having fibers going this way, and this way, and having these layers gives you strength. And so your abdominal muscles, obviously, you're going to tense them to when you're, predicting someone hitting you, or they allow you to do, kind of a twists when you do an ab workout, when you're doing sit-ups, things like that. And compressing your abdominal muscles are going to compress your abdominal cavity. And so that's important when you're giving birth or emptying your bladder or your colon, or it's also by pressing your abdominal cavity, it's going to push up on your chest. So you use it when you're coughing. You give the Heimlich maneuver, you're going to push on the abdomen. It actually pushes your guts up, and it puts pressure on your diaphragm, and it's going to do that. So you all know, if you're watching a comedy and just laugh so hard for so long, your abs hurt, right? Or if you're coughing, your abs hurt, because when you compress those muscles, it squishes on your guts, and it's going to push up to help you expel air too. All right. So these muscles, the 3 layers in your abs, you're going to have external oblique, like putting your hands in your pockets, come in this direction. Internal oblique generally goes the opposite direction, just inside of it. And then transversus abdominis goes straight across your abdomen. And then, of course, your 6-pack is rectus abdominis. And rectus means straight. We're going to have our rectus femoris, goes right down our femur. So 6-pack muscle here. So looking at this, breasts kind of jump out of me here. Look at this picture, kind of bam. But just to show you that the breasts are fats and glands that are in the skin. All right, so there's behind the breast, behind this fat tissue, is between that and the deep fascia that covers your pec muscles. So the breast can move on the muscles. It's really part of the skin, so it's not like attached in there. And then below it, you see your 6-pack, right? I keep mine hidden under some fat, just so I don't show off too much. But these 2 strap-like muscles, they come off your sternum. They'll come off your sternum and ribs, and they'll insert down in your pubis. And they're 2 strap-like muscles. And they have these little, call them tendinous insertions, that separate the muscle into these little parts that give you your 6-pack there. Yeah, take a look. So you see, running right down the front are these 2 strap-like muscles, your rectus abdominis. They often have these little insertions that give them that kind of look. And then your obliques, and oblique means at an angle. Transverse means straight across. Oblique means at an angle. So your external oblique is your outermost muscle right under your skin, and it kind of comes down like this. And then your internal oblique is internal to it, and it generally goes kind of the opposite direction. I say generally because it starts out that way, then it kind of goes straight across. But you could think of it as going external comes like hands in your pockets, and then internal kind of opposite direction. And then the deepest layer is your transversus abdominis that kind of goes straight across. It's not oblique at an angle, but it's just transverse. Yeah, and together, it's a little complex. Oh, I'll show you another slide, kind of complex. Right down the middle, you have this white line. It's called linea alba, like albino white. So right down there, and it's just a tendon, really tough connective tissue. And your 2 rectus abdominis that come down are in these sheaths, this connective tissue sheath, and they're kind of connected to that white line in the middle. and I'll just show you, just to introduce it, to give you that idea, is that you can see your two six-pack muscles, your rectus abdominis, they're in these really tough sheaths of connective tissue, collagen fibers, right? They're in these sheaths that connect in the middle to this connective tissue right down through your belly button, this linea alba. And then you can see your three abdominal muscles coming together, particularly that internal oblique kind of comes and makes that sheath. So they're interconnected. And so, you know, they're inserting on this common tendon in the middle, this linea alba, all these abdominal muscles. So they are going to make those obliques, going to give you a little twist. All of them are going to compress your abdomen for coughing or vomiting or getting rid of a baby, something like that, compressing your abdomen. All right, let's look at the muscles in the thigh. Now, when you look at your thighs, this is your thigh. Your leg is technically from your knee down. This is your thigh. You're going to have muscles in the front, your big quadriceps, right? You all know your big quads in the front. A few muscles in the back, your hamstrings. And then a big group in the middle between your legs. Those are the adductors. And they're going to bring your legs together, add your legs together. And you're going to see there's only really one muscle involved with abducting your legs, like spreading your legs out. So we don't have a lot of power there. We have a lot of power in bringing them together. And then, of course, hip flexing is moving your knee up. Hip extending is moving your leg back. And so you can abduct or adduct, flex, extend. Yeah. So first of all, I put these two muscles together. What you usually do is iliopsoas. See, the P is silent. So iliopsoas. It's going to be iliacus and psoas muscles come together to make this. It's your main hip flexor. So bringing your leg up. And then your glutes. We'll talk about your glutes, biggest muscle in your body, the big gluteus maximus. And then a little muscle on the side there. We're talking about the IT band. Yeah, this little tensor fascia lata that's going to kind of insert on it. And then, yeah, we will talk about gracilis, this little medial muscle. So I'll show you the ones that I'm going to focus on, obviously. So first, your hip flexor. So this is bringing your legs up, your thighs up, right? Flexing your hip. And you can see here, this person is stretching their left one by doing this kind of a stretch, right? And so the main hip flexor to move your thigh up is a combination of iliacus and psoas muscles. And by the time they come out in the models in lab and cadaver, they're fused as one muscle and tendon called iliopsoas. Yeah. So remember, you know, when you're dissecting the leg, looking at a leg model, you're not seeing all this. You're just seeing the outer part. But now you see where they come from. Psoas coming off the lumbar vertebrae. Iliacus fills the inside of your ilium, and they come out together to insert onto your femur. And they're going to move your femur up as if you're high kicking, going over a hurdle, right? And then the glutes, big old gluteal muscles. And gluteus maximus, you know, comes off of a little bit of your ilium and your sacrum and your coccyx, and it's going to come down and insert onto your femur, and also on the fascia that tough bandage that holds your leg together. And so gluteus maximus is going to extend your thigh, all right? And so if you walk around the room, I feel a hand on my butt. The gluteus feels kind of gushy. It's not really tense, right? Where you really feel is if you go upstairs. So you're going upstairs, you're getting up from the couch. That's where the glutes, when your leg is already flexed, when your thigh is already flexed, it really is going to help you, you know, to it uses the power then. Once you're walking around, it doesn't do very much. So you use that power in powerfully extending your thigh. Yep, beautiful, big muscle. Underneath it is gluteus medius, and below that is gluteus minimus. So maximus is maximum, medius is medium, and minimus is the minimal one, right? And medius, if you could see it, actually comes up here underneath. Oh, sorry, I shouldn't overlap there. It comes underneath. And when you give a gluteal injection, I mean, I got my flu shot last week in my deltoid here, but if you want a bigger muscle mass, you can get a shot in the butt region. And they do it up high. They do it up high. If you don't want to give it down here, because there's a huge nerve under there called the sciatic nerve. And you don't want to put a needle in that, right? So you often, if you learn this, you give it up high into the still gluteal muscle, but it's not down low in that fold down there, it's up high. So gluteus medius is a different animal than gluteus maximus. You can see it's going to insert way out on the tip. It's going to be the greater trochanter, but way out on the tip. So medius is important for abducting your thighs, moving your legs out. It's really the only powerful muscle. You'll see tensor fasciae lata does a little, but so that gluteus medius is important for abducting. And you have so many more adductors, and I guess you don't need as much power for kicking outward. In soccer, you use that to do a pass in that direction, but it's not clearly your power move at all, right? So, but we're going to see why gluteus medius is important. I'll show you in the next slide. And minimus, not going to talk much about it. It's just the smallest muscle deep to both of them. Yeah, so gluteus medius, I want you to know it is the abductor of your thigh. It's going to move your legs apart. And where it becomes important is in normal walking or running, but in your normal gait, you can take a look at someone walking away from you and you can tell if their gluteus medius is damaged, they're going to walk like this. Their hips are going to go back and forth, kind of like a duck walking. So what happens in normal locomotion is that when you walk, imagine when you lift one leg, then you're balancing on one leg, but you don't think about it. But normally if you lift a leg, your hips should tilt. But your gluteus medius on the opposite side of the leg you lifted tenses and it holds that leg steady so your hips don't tilt. So that is it's a isometric contraction. So it's working, but it's not moving anything, it's tensing. And so as you walk, you alternate your gluteus mediuses. Whatever leg you lift, the other gluteus medius tenses and keeps your hips from falling. Isn't that cool? I mean, that's really cool to understand that, because so as you guys walk, unless you're walking with your hips up and down like that, it is keeping your leg on the ground steady as you lift a leg, when normally you'd want to fall that direction. All right, you got it? Good stuff. And so on the side, you have, and if you runners and people with issues know about your IT band, it's your iliotibial tract or iliotibial band. So it comes off your ilium, your hip, and it goes below your knee to your tibia, actually. You see it's on the lateral side, but it comes around to your tibia and your fibula a little bit. But so IT band on the side, and if it's tight, maybe some of you have taken one of those pool noodles and like rolled yourself on it to try to loosen it up. But the fascia that surrounds your thigh is wicked thick, really strong. And on the outside of your legs, it gets particularly thick, and we call it the IT band. And connected to it, we have a muscle called tensor fascia lata. So remember latissimus dorsi, it has the broad muscle of your back. Well, tensor fascia lata is like the broad ligament around your leg. So it's going to tense it. All right. So tensor fascia lata is connected to your IT bands, and it's found on the outside of your hip like that. It does a little abducting and rotation, but that's just very minor. I want you to know it's connected to your IT band. It's going to help tense that. Yeah, another look at tensor fascia lata. Yep, little meaty muscle on the outside of your hips. And this is showing gluteus medius again. If you don't have it, your hips are going to tilt, because normally on the planted leg, it's going to contract and keep your hips steady. All right, a small muscle. And so I didn't do all the adductors, but take a look. You've got adductor longus, brevis, magnus, all kinds of muscles on the inside there that we're not going to get to, but you have a lot of muscles in the inner part of your thigh that are going to add them together. But we'll do one here that you can see is gracilis. And gracile means slender, lithe. It means, yeah, little, slender, delicate kind of thing. And it is. It's a little muscle that's found on the medial side of your legs. It's like Sartorius. Sartorius, remember, came like this, little strap-like muscle. So it's a long muscle on the inside, very flat, thin muscle. It goes from the pubis down to your tibia. So it crosses the hip and the knee. It's going to be a weak knee flexor. You imagine compared to your Your hamstrings are powerful, flexing your knee. Well, we'll get to them. But gracilis is going to be weak. And so this thin muscle is sometimes used for muscle grafts because it's so inconsequential. You have so many bigger muscle masses that do the same thing. Much like your fibula, I talked about, you can remove a piece for a bone graft. Your gracilis is what you would say if you need some muscle. This is kind of cool. They took a piece of it and put it to help this person's biceps. So again, gracilis, very thin, strap-like muscle on the inside of your thighs. All right, this is like a long list, but it's not too bad at all. We'll see Sartorius. It causes you to sit cross-legged, very cool muscle. And then your quads will be 4 muscles, easy, your quads. And then your hamstrings, we got 3 muscles that make up the back of your thigh. All right, let's do it. So your hamstrings, we'll start with that. Your hamstrings, the back of your leg, so you don't have that many muscles back there, you can see. They're very long, slender muscles that you can pull them a lot. You get a pulled muscle. And they're complex because they cross 2 joints, all right? They come off your ischial tuberosity, and then they cross your knee too. So they have effects on your hip and your knee. And you notice this, your hamstrings, so they're going to flex your knee. Got that? Flex your knee, got it? And so if you extend your thigh back here and try to flex your knee, it feels weird. It just does not want to work, right? Now, if you flex your hips here, then, oh yeah, I can flex my knee. So because of this, it's this muscle, if you're extending your thigh, it doesn't work very well to flex your knee. I don't know if you guys can see that. You definitely feel it. Get up and give it a try. Try to flex your knee with your leg back. It just does not work very well. The hamstrings, the muscles, what are they called, right? They're called semimembranosus. It's like a big membrane, flat. And then semitendinosus. There's this one. I don't see where it says it on there. I guess I'll show you next. And this is like a tendon. See how it's like a tendon down there? And so you're going to feel that in the inside. When I feel the back of my knee on the inside, I feel those tendons. If I feel on the outside, I feel a big tendon. That's biceps. So biceps femoris is on the lateral side. So you feel the back of your knee, you feel tendons on either side. And you may hear the term, I'm going to hamstring an opponent, or why is it called a hamstring? Well, and pigs, whatever, those tendons back there, you can hang them up on a hook, right? You cut off the hoof, no one eats the hoof, and then you hang it by those strings, you can hang them up there. And obviously, if you cut this on a person, they're not running anywhere. You've hamstringed them. They can't run. Yeah, and looking at biceps femoris, remember, not biceps brachii, biceps femoris, you can see that only the long head is truly a hamstring. A hamstring has to come from your ischium to below your knee. The short head of biceps meets it, and it comes off the femur, but it only crosses the knee joint, see? So your hamstrings are really semitendinosus, membranosus, and the long head of biceps. And they're going to extend your hip and flex your knee. Guys, hopefully you can see that. All right, Sartorius, I love it. A sartor means tailor, and that's someone that sews. And so they would often get in this cross-legged position on the floor to work on their fabric like that. And so it's a real thin strap-like muscle, comes off your ASIS, anterior superior iliac spine, so this little hip pointer that you feel, and it comes across your leg. If you look at this anatomy for artists, I got that from that. You can see it in some people. And then it comes around and it goes past your knee on the medial side. So it's going to cross the hip and the knee joint. And it's going to cause that complex action where you're going to flex your thigh, flex your knee, and outwardly rotate your thigh to put your legs in that cross-legged position. Cool, huh? So it's a long, thin, parallel fibered muscle, so it can really contract a lot, shorten a lot, but it doesn't have a lot of strength because it's just long fibers. Sartorius. All right, your quads. Yeah, look at this guy down here. So quadriceps femoris, four-headed muscle of your femur. They make up the big muscle mass in the front of your leg, right? Yeah. And so you see the teardrop shape down in your knee, especially it's be vastus medialis and then vastus lateralis. Vastus means big, vast, right? And then rectus femoris is found in between it. And rectus femoris, you can see it as a pinnate or feather-like structure, means straight down your femur. And it's different than the other three because rectus femoris comes off your ilium. It comes off your hip. So it crosses your hip and your knee. The other three, vastus medialis on the inside, vastus lateralis, and there's a little one, vastus intermedius, like underneath them all. Those three are purely going to be extending your knee. But your rectus femoris extends your knee. It's also going to be a little bit of hip flexing because it comes off there. These three come off the femur, so they only cross the knee joint. Yeah. What do I have to say? Big, strong muscles, kicking the ball, you know, extend the knee powerfully. All right. Much like I simplified the muscles of the forearm, from the calf, I'm going to simplify things too. We're going to talk about the two big calf muscles, gastrocnemius and soleus, and then one in front, tibialis anterior. But we're missing the muscles that extend the toes, extend the big toe. And in the back, we have muscles that flex the toes, flex the big toe, and some muscles on the side that help keep the ankle from twisting inward. So we're missing some of these muscles just because of time constraints, but I'll give you these big ones. So for the front, tibialis anterior. So on your own shin, you can feel your tibia, that bone. Feel just to the outside of it, you'll feel muscle. And there's a wicked tough membrane on there. So you can kind of feel the muscle under a membrane. And I talked about compartment syndrome, remember? So it's so tough. And shin splints, yeah, people maybe overuse, you get little micro tears in this muscle, very painful. Yeah, or compartment syndrome, where if you overuse the muscle, there's pain in there. It's going to press on the nerve, prevent blood flow. Yeah. Anyway, so this tibialis anterior runs right down the front. And you can see it also at the foot. If you guys have your shoes off, you kind of invert your foot and a big tendon comes out there. So tibialis anterior is going to insert here on the first metatarsal, that first metatarsal and one of those tarsal bones. And it's going to help invert your foot. So inverting your foot like that and dorsiflexing. You take your foot off the gas pedal. So dorsiflexion and inverting your foot. Tibialis anterior. Your calves. All right, we're just about done here. Your calves. We have big calves. And again, the bodybuilders, just like, you know, the biceps get all the accolades, your gastrocnemius gets all the accolades when you work out your calves, because the medial lateral heads can be these balls and they really show up on your calves. But let me tell you, the real star of the show is underneath it is soleus. Kind of looks like a fish, you know, like a sole, sole, and it has more muscle mass than gastrocnemius. Now, both of these are going to cause you to stand on your toes, which we're going to call plantar flexion. So plantar flexion, dorsiflexion is foot off the gas, like that tibialis anterior. Your calf muscles, you can see how they're so big because this kind of motion is how we kick off, how we jump, right? We plantar flex. And so it's lifting your entire body weight, right? By these big, strong muscles. Now, what do you notice about this? Gastrocnemius crosses the knee joint. You guys see that? It comes up above the knee. Soleus is coming off the tibia and fibula. So soleus is purely acting on the ankle joint. Gastrocnemius is going to flex your knee and work on the ankle joint. So it's a little more complex. Both soleus and gastrocnemius, along with a little tiny muscle, tiny little plantaris muscle, are all going to come together on your commonly called Achilles tendon. Calcaneal tendon is the way the book goes, because your calcaneus is your heel bone, right? And so they're all going to come together in this common tendon. You can feel the back of your ankle, that really strong tendon that's going to insert onto your calcaneus to transmit all that power of your calf muscle into plantar flexing. Yeah. And don't only think about it standing in your toes, but I'm ready to watch the Chiefs game a little bit, is, pushing off, push off. That power of plantar flexion is going to give you that power coming off the blocks. All right. So let me ask you about, oh, that's it, last slide. Oh, we're just about done. Let me ask you about this. When you work out at the gym and you're doing calf raises, now, if you want to work soleus, you can do calf raises in any position, standing calf raises or seated calf raises. If you want to isolate soleus, you do seated calf raises, where you're, you put the weight here, and then the weight is put on your thighs, and then you do calf raises. The reason why that isolates soleus is that gastrocnemius cannot be involved if your knee is bent. If your knee is bent, gastrocnemius crosses the knee joint. It's all like flapping in the wind. But soleus works in any position, right? So then you isolate soleus. If you do standing calf raises, then gastrocnemius can also be involved. So something to think about. All right. So major skeletal muscles of the body. Obviously, it's a big part of A&P, anatomy and physiology. God, we've done the bones, major muscles. And you can see the difference. We'll talk about, looking at this different sizes of muscles. This guy does not wake up like this. That takes a lot of work, because you need to train those muscles, and you put on more fibers. You get more actin and myosin fibers. You get bigger cross-sectional area, which gives you more power. But if he stopped working out for a few months, it would atrophy. And so this is just like your bones are going to change based on the stresses put on them, your muscles will too. Muscles react to being overloaded, even injured, teared, and then they will, as long as you don't work the same muscle group day after day, you give it some time to repair, muscles will increase in size, giving you more strength. All right, class. So a lot of talking today, because I just gave all the muscle groups of the body in 2 sections, 2 lectures. All right. Hope you're all well.